We've got really, really sick individuals in the hospital, and they continue to come in.
As of Tuesday morning, GMH Administrator Lillian Posadas reports there are 51 COVID patients at GMH. 14 are receiving ICU level of care and 12 are on ventilators. A somber reality that Guam remains under siege by COVID.
And so that's what's been happening. These individuals get so critically ill that they crash and they go into cardiac respiratory arrest. So we have to call on code blue and resuscitate them.
The capacity to care for COVID patients at GMH has reached a critical level that Posadas admits decisions have been made to cut certain services.
We're not going to be accepting any more non-COVID ICU patients. We are strictly the COVID ICU unit here at GMH, and GRMC will then take the non-COVID ICU level of care of patients.
Although the hospital was hoping to start sending patients to the SIF or COVID isolation facility at the skilled nursing unit in Barragata Heights over the weekend, Posada says it just wasn't possible.
Unfortunately, the acute and critical patients on our side here in Tamuning has taken our focus and our attention.
Despite the fact that a contingent of off-island nurses from DOD have temporarily been sent in to help, Posada says they're still short-staffed.
I know that there were several others that our infection control nurse and our employee health nurse have been sending us information as far as who else are out. And so those numbers probably around 6 or maybe even up to 10 additional staff were out.
Last week, Posadas confirmed 32 hospital staff, including nurses and doctors, were sidelined because of COVID. Some have since been cleared to return to work. Long term, however, GMH is working with a recruiting agency in California in hopes of securing up to 100 nurses to help with their shortage. Some of these nurses, Posadas says, could also be stationed at GRMC.
They're going to need help, of course, and so, I have no problem, providing assistance and support there too, because it's only for our entire healthcare system. It's not just for GMH, it's for the entire healthcare system for Guam.